distinguished Mrs. Papoulia, Dear President Mrs. Lambro, κυρία Πρόεδρε, κυρία Λάμπρου, σας ευχαριστώ πολύ για τα ευγενικά σας λόγια. Πρόεδρε της EURORDIS, είναι πραγματικά πολύ μεγάλη μου τιμή να με έχετε προσκαλέσει από την EURORDIS σε αυτή την συνάντηση για να απευθυνθώ σε εσάς και θα μπορούσα να πω ότι χωρίς πίεση από πλευρά σας σχετικά με την πολιτική διαδικασία δεν θα μπορούσαμε σήμερα να έχουμε
of the European Union regarding the rare diseases. So your fight was really successful, but I can tell you one thing. Now we begin because we really have something we can follow, we can press on, and we can be very, very successful. You will permit me to present to you the essence of this recommendation, which I had the honor to be the rapporteur in the European Union, in the European Parliament, and you will permit me to speak in my mother language. Thank you very much. Οι σπάνιες νόσοι
largely contribute to the rates of mortality in Europe. However, these cases are often not being recorded, not being registered due to the lack of healthcare data centers and data systems. Despite the fact that rare diseases actually contribute to mortality and morbidity, they're almost always absent from IT systems in healthcare systems due to the lack of proper classification and codification systems. The recommendation of the European Parliament regarding a European action in the field of rare diseases was absolutely necessary because the coordination of the actions and activities should take place not only on national level but also on the level of the European Union. This is justified by the rationale that despite the fact that the incidence of any rare disease is extremely low, in the European Union, there are millions of people affected by them because the number of these rare diseases is extremely high. Therefore, it requires specialized centers for the coordination, mutual support, treatment and diagnosis, and quite possibly mobility for those patients, which is a fact we anticipated in the report submitted before the European Parliament regarding the patient's mobility. This report concerning the patient's mobility is one that has become a guideline, therefore it is mandatory for member states. However, the suggestion on behalf, excuse me, I apologize, he continues in English, someone is calling him. Συζητά συγγνώμη, αλλά κάποιος τον καλεί και πρέπει να το κλείσει. However, the suggestion by the European Parliament was inadequate. This is so because it did not describe, at least in generic terms, neither the required financing or the co-financing that could take place in conjunction with the member states or other organizations and quite possibly even pharmaceutical companies. And furthermore, it did not have specific data based on which one could guide the course of this recommendation in order to have an effective treatment of rare diseases on the level of the European Union. In the text, the European Commission was called upon to submit a suggestion for the implementation of the measures 5 years after their ratification or approval, which was a long period of time during which no possibility would be made available for any actions, but also did not anticipate any financing whatsoever. Therefore, it began with a recommendation that would be actually implemented 5 years later, and after those 5 years we would actually be starting from scratch once again. Therefore, in my capacity as a rapporteur, I suggested that the European Commission met in order to modify the deadline and ask for the submission of a deadline up until the end of 2012, because according to the recommendation we're asking from all member states to provide us with all the data by the year 2011. Therefore, the European Commission, having gathered all the data until by 2011, would then be able to proceed to the suggestion of their implementation. These suggestion for implementation should include some things that we also describe in this report. For example, first of all, gather all the epidemiological data and the drafting of a list of rare diseases. You immediately realize that there is a gap here. When you ask me and say, but how many are there? How many rare diseases are there? My answer is 6,000 to 8,000 rare diseases. So it's not a clear answer. 6,000 to 8,000 is a big difference. It's a big discrepancy. So we must have a much better recording of all these diseases and know a more precise number. If you ask me how many patients suffer from a rare disease, I will tell you that in Europe they range between 27 to 36 million patients. But the difference between the two ends is very, very big. So it's absolutely necessary to have a clearer registry in order to have a better picture of rare diseases throughout the European Union. Secondly, we must create networks, because when we gather these pieces of information, information today is diffused through networks, and these networks should be linked with one another. There must be a center. It will obviously be a center at the European Commission or specialized service linked with all member states, where all data will be coming in from and will be going out to. We need expertise centers. The rare diseases are difficult precisely because of that. Let's take a rare disease, for example, Gaucher's disease. First of all, by definition, a rare disease is that there shouldn't be an incidence higher than 5 cases per 10,000 people, so 10,000 individuals. So there are rarely experts in so rare diseases. Those who will deal with a patient suffering from a Gaucher disease in Europe cannot be more than 10 in Europe. So the patient has a problem. Which of these 10, let's say, experts will be able to treat them, to deal with their problem? In order to find that out, we need to register the experts we have, how many centers we have, hospitals, research centers, diagnostic centers in Europe, etc. Because if, for example, in Greece, where we would be very good in diseases linked to blood hereditary diseases, because we've had a great experience on that, or even Italy could do this as well. On the contrary, we would hardly find a patient in Sweden with thalassemia.